good evening or good morning, depends on where you are. Um, Welcome to the second session of the global lecture of the Chinese economy, 全球中国经济大讲堂. Today we are going to have three talks about long-term care, gene economics, as well as productivity analysis. The first speaker over this session is Professor David Grabowski. Dr. Grabowski is a professor of healthcare policy in the Harvard Medical School, and he is also a member of the National Academy of Medicine in the United States. His research examines the economic of aging with a particular interest in the area of long-term care and post-acute care. He has published over 240 peer-reviewed articles, and his work has appeared in leading peer-reviewed journals of economics, health policy, and medicine. Today, he is going to talk about workforce challenges in the care of older adults. Dr. Grabowski.
Thank you so much, Adam, and hello, everyone. It's really great to get to spend some time with you, I guess either this morning for many of you and this evening here in Boston. So I'd like to talk about an issue that I think is important all over the globe. It's important here in the US, and it's important in China. And that's how do we find workers to care for older adults? As we know, care for older adults is incredibly labor intensive. It takes a lot of person hours to care for an older adult who is suffering from physical and cognitive impairment. So it's a real challenge. Where do we get the workforce? I know not everyone's an expert on the US nursing home sector, so I just would like to say a few words about nursing home care and the importance of labor in the production of nursing home care. So the market for long-term care, of which nursing homes are one part of, is quite large here in the US. We spend annually over $400 billion, or about 9% of all national health expenditures on long-term care. And it turns out many of us will ultimately need a nursing home. Among those age 25, about 1 in 4 will end up using a nursing home. Among those who live to age 65, almost half will end up using a nursing home. In 2021, roughly 1.4 million Americans lived in nursing homes. That's about 2.5% of all individuals age 65 and above. I think it's important to note that the reason these individuals are in nursing homes is that they need assistance with activities of daily living. They've lost the ability to care for themselves, so they're incredibly vulnerable. As you can imagine, and as I've already said, labor is really important towards the production of high quality care. Labor represents about 60 to 70% of nursing home spending. And the different staff types involved in the production of nursing home care include nurses, of which we have registered nurses or RNs, and licensed practical nurses or LPNs. But the individuals doing the bulk of the direct care for residents are what we call certified nurse aides. And CNAs provide almost 80 to 90% of the care for individuals living in nursing homes. They're predominantly women. Many of them are recent immigrants and minorities. They're paid quite low in many instances. They're near minimum wage rates in the United States. And as an example of just the low wages that they face, many of them, less than half, don't have health insurance coverage through their employer. Staffing, once again, is the key input into high quality nursing home care. And there's lots of evidence, a lot of which our group here at Harvard has helped to produce, suggesting the more you invest in staff at a nursing home, the better the outcomes in terms of fewer survey deficiencies, fewer pressure ulcers, less residents that need to be physically restrained, less use of inappropriate antipsychotic medications. fewer transfers to the emergency department or the hospital, and greater satisfaction on the part of residents and a higher quality of life. This was a paper that we put together prior to the pandemic. It was led by a former doctoral student of mine who invited me to speak today, Feng-Li Gong, who is now on faculty at Brown University, just down the street from Harvard in Providence, Rhode Island. And what Feng-Li and myself and another colleague looked at was what share of facilities meet the acuity adjusted expectation that the government had put forward. This wasn't a regulatory or mandatory standard. It was just an acuity-based adjustment for what we would expect nursing homes to have in place. And it turned out most nursing homes, most of the time, were below the CMS acuity adjusted standard. We've also done research suggesting that nursing home workers don't stay in these positions very long. There's huge turnover, and what I mean by that is staff members leaving the nursing home. So you can see on the left there, across all staff, we observed a mean turnover rate of over 100% and a median close to 100%. And this was high for all three staff types I talked about earlier, RNs, LPNs, and CNAs. You can see on the right there the distribution. There's an incredibly long tail to the right, with some facilities having their staff turn over 2 or 3 or even 4 times over a calendar year. This is not associated with high quality care, as you can imagine. Lots of evidence that staff in the United States weren't well supported by policymakers during the pandemic. We saw staffing shortfalls both during COVID outbreaks and then following these outbreaks. Many nursing homes lacked personal protective equipment. We often lacked access to rapid testing. And indeed, we also showed that nursing home staff had the most dangerous job in America during the pandemic. The death rates per capita for nursing home workers was higher than any other profession. Commercial fishermen, logging workers, some of the professions that typically have high death rates in the US, they were actually lower than nursing home staff during the pandemic. We lost a lot of workers during the pandemic. And you can see that here with the big decline right in March 2020. We lost nearly or over 400,000 workers, and that's come back, but we still are down over 80,000 workers since the start of the pandemic in the nursing home sector. Many economists are probably on the Zoom right now saying, well, let's just pay them more. Well, we did pay them more. And you can see here, I would argue higher wages are necessary, but not sufficient. And on the left, you can see all the different healthcare professions, workers in offices of physicians, dentists, hospitals, SNFs are nursing homes here, skilled nursing facilities, home health, and other healthcare sectors. You can see on the very bottom there on the left, the nursing home sector lost the most workers, yet on the right here, it had the highest relative increase in wages. This doesn't mean we shouldn't have increased wages. It means we needed an even higher increase to really retain the workforce. Being a nursing home worker during the pandemic was really challenging, and many individuals left, even in the context of higher wages. Not surprisingly, our work also showed that a number of nursing homes had to turn to agency-directed staff. We published a paper earlier this year showing that the share of hours worked by contract agencies that come in and work on a temporary basis went from a baseline of about 2 to 3% up to, depending on the staff type, between 10 and 14% during the pandemic. So nursing homes really struggled to find staff to work in their buildings. We also showed in a different manuscript that we published earlier this year that many of the individuals who left the workforce were actually native born. Many of the immigrant staff members, those who are foreign born, were the ones that stayed. And I like to say, think of how much worse the staffing shortage would have been had foreign born workers left at the rates that native born workers had left the sector. And you can see here, this is just across states. Each of the dots here represent a different US state. And you can see that upward sloping line where we're just plotting on the left axis there, the direct care staff hours per resident day, and across the bottom axis, the percent of CNAs who are foreign born. And those states with more direct care hours were the ones that had more foreign born CNAs. We've also done some research. This is a National Bureau of Economic Research working paper evaluating what happens when immigrants enter a particular market. And what was really powerful in this, we use a shift share instrument. I won't get into the details of that, but we find for a 10% increase in female immigrants, remember, most of the workers are female, we're seeing an increase in all three staff types, CNAs, LPNs, and registered nurses, between about 0.7% and 1.1% increase. And it's important to note here, they didn't drive down wages among native-born workers. This is a pretty inelastic. There's a pretty inelastic demand for staff in this marketplace, and nursing homes need more workers. And so, when there was an influx of workers, it led to more kind of staff members, but didn't decrease wages. In this same NBR working paper, we also found higher quality in the context of an immigration shock. Fewer readmissions, fewer pressure ulcers, fewer infections. So really encouraging in terms of increased immigration. In addition to raising the rate of immigration and in reforming immigration policy, I like to say that immigration policy is long-term care policy. There are other ideas, and I published a piece in Politico back in March of 2021 and offered some other ideas for how to grow the workforce. I titled it "Nursing Homes Need Fixing. Here's where to start." We need to pay our workers better with increased benefits. We need to increase minimum staffing standards, and obviously the U.S. federal government is right now going down that path to institute a minimum federal staffing standard. We need to raise reimbursement rates and then increase financial accountability such that we know that the dollars that are paid to nursing homes are going into direct resident care. We need to provide more outlets for residents to advance in terms of their career, and we need to make these better jobs. As I just said, President Biden did put forward minimum staffing as part of his nursing home quality and nursing home performance. The minimum staffing rule is been a really exciting development. Under the existing rule or prior rule, nursing homes were just required to staff at a level that ensures resident safety and well-being. They had to have an RN or LPN present in a facility at all times. Now, under the new rule, which will go into effect over the next several years, if it makes it that far, there've been a lot of challenges to the rule. But each facility must have almost 3.5 hours per resident day of staff time, including roughly a half hour per day of RN time and 2.5 hours of CNA time. And importantly, there's no LPN requirement. They're now required to have an RN present in the facility 24/7. Some nursing homes will be exempted based on local labor market conditions. The federal government here has given a long ramp-up period, so 3 to 5 years, and they've also put forward $75 million train new workers, because it's always a struggle to attract new workers. You can see that it's going to be a challenge. Nationally, 57% of facilities currently meet the 3.48 hours per resident day, but it varies quite a bit by facility, from Alaska, where all the facilities meet the standard, to Texas, where only about a quarter do. Only 19% of nursing homes nationally meet both the RN and CNA thresholds. And you can see that once again, the real range there in terms of states. So these would really be binding thresholds. I wrote a piece with a colleague in the New England Journal of Medicine late last year, where we argued that this is a really important, maybe the most important nursing home reform in decades, but it's far from perfect. And we argued at the time that the overall staffing level wasn't addressed. Thankfully, CMS did ultimately address that and include it in the final rule. But they still have excluded licensed practical nurses, a really important input into the production of high quality care. We argued they probably shouldn't be exempting nursing homes in tight local labor markets. If nursing homes can't recruit labor at the existing rates, that suggests broader payment failures. We argued the rule could be implemented faster, especially in those higher staff states. And we argued this should be the start, not the end of a broader set of nursing home reforms. And one of the things that's really concerned me about LPNs, and this is just a graph my colleague Brian McGarry put together for me, you can see at baseline there prior to the pandemic what's happened to the various staff types. And you can see in red there that we have fewer RNs today following the pandemic, whereas we're using a lot more LPNs. Remember, the rule is going to ratchet up the requirement on registered nurses and not have any requirement for LPNs. There's really a disconnect between how nursing homes are staffing today and how this new rule is set up. The other big sort of question around this policy is whether nursing homes have the dollars to pay additional staff. One of my prior policy roles, I was a member of the Medicare Payment Advisory Commission, or MedPAC, which advises the U.S. Congress on Medicare policy issues. And one of the things we did every year was calculate all payer margins, and then a non-Medicare, or what we say Medicaid, largely Medicaid margin. So these are just operating margins. You can see nursing homes did pretty well during the pandemic in 2020 and 2021, but they're really struggling. And they're especially struggling because the dominant payer of nursing home services in the US is Medicaid, and Medicaid is not a generous payer. And this figure shows that this is work by MedPAC's sister agency, MACPAC, which looks at Medicaid payment. And you can see this is just across the entire country, what share of facilities are paid above their acuity adjusted costs. And only about 1 in 5 facilities are paid above costs. The vast majority of facilities are paid below costs. And indeed, some are as low as less than 60%, or between 60 and 69, or 70 and 79%. And then there's an important limitation to this earlier work. And MACPAC wrote, we were not able to examine the effects of related party transactions. What they meant by that was that their nursing homes in the United States have very complicated ownership structures. And oftentimes the cost reports that they submit to the federal government hide some of their profits through these same owned or commonly owned parts of their businesses, where they can hide profits in a real estate management company, or an operations company. And so it looks like they're less profitable than they actually are. And that's why I really think when the Biden administration is thinking about reforming staffing, we need more workers. They really need to combine those two reforms, the minimum staffing standard, along with improving financial and ownership transparency. We need to know what nursing homes are doing with the public dollars that we're entrusting them with. Who owns these different parts of the company, and what share of the dollars are actually going towards direct resident care. And I wrote a piece with my colleague, David Stevenson, making exactly this point, and we published this earlier this year in Stat. And it's been really hard to untangle whether we need more public investment, as nursing homes suggest, or are there sufficient dollars already in the system, as many advocates contend. We're sort of at kind of a bit of an impasse. What we lack here is really data, and with information on how nursing homes are using the existing dollars, what parts of the company they own, we can actually see their true profit margins and actually see whether we need to increase reimbursement rates or whether we just need to increase accountability in how nursing homes are spending existing dollars. So I want to summarize here, in order to solve the current workforce challenge, whether it's here in the US or in China or any country, it's going to take, I think, a multi-pronged approach. Obviously, we need more immigrants, but that's a complementary approach. That's not instead of. We need to both increase foreign-born workers, but we also need to pay them better, improve their working conditions, and do all the other measures that I discussed earlier. We need to make these better jobs. And to do this, policymakers are really going to need to determine whether current issues with staffing are because we're not paying enough or because providers aren't using dollars in the way that they're intended. Until we really get a handle on that, I once again would assert we're really at an impasse in the U.S. Final slide, I want to make the point, and these are just two figures or tables from the OECD. The top one is just total long-term care spending as a share of gross domestic product. You can see on the left there, the countries that spend the most are largely Northern European countries like the Netherlands, Norway, and Denmark. The US is not out there on the left like it would be in healthcare spending. The US is towards the OECD average, right next to Japan and Iceland. But I think the point here, and unfortunately China's not on here. If it was, Feng Li tells me they'd be pretty far towards the right, although I think China is really primed to increase their spending over the coming years, much like the United States, due to aging baby boomers hitting their long-term care years. So I think both of our countries will experience a real increase in spending in the coming years. But I want to make the point that it shouldn't surprise anyone. Those countries that spend the most tend to have the most workers. And it's not kind of one-to-one in terms of the correlation, but Norway, Sweden, the Netherlands, they're all towards the top of the list. And then if you look, on the bottom end, countries like Greece and Poland are towards the bottom, and they line up pretty well. We're going to have to find more money, and we're going to have to make sure it's being spent the way it's intended. And once again, that's going to have to happen here in the US and also in China. So I'll stop there and turn it back, Adam, to you, and happy to take questions or comments.
Great. Thanks, David. This is really a timely presentation for Chinese audience, as China is building its long-term care system. We do have quite a few questions. The first question probably is a little bit loaded, I would say. It's asked about Dr. Grabowski. He has a question about the role of social organizations. For example, the American Association of Retired Persons, AARP. What roles it's play in the process as a lobbying organization?
Yeah, the lobbyists have been obviously important. I think AARP, unfortunately, historically hasn't been as focused on nursing homes. They've been a great advocacy organization for expanding home and community-based care options outside of nursing homes, but they largely kind of ignored this issue. And I think more recently during the pandemic, they've gotten a lot more interested in nursing homes and nursing home quality. So my hope is that they're engaged in this issue because we 100% need their voice. They're such a powerful group. But I unfortunately, and it speaks to a larger issue just very quickly, Adam, that nursing homes are kind of an issue that nobody wants to think about. And it's the policy, it's a great policy issue that isn't a policy issue in many respects because it doesn't come up. And I give the Biden administration a lot of credit. They've raised this issue. They've tried to really champion some really tough policies, but it rarely comes up in presidential debates. It rarely comes up in a lot of venues. But I hope in the coming years, as we have more and more older adults, both here in the U.S. and China, that we get much more discussion on this issue. It shouldn't be a back burner issue. It should really be a front burner issue for a lot of families and policymakers.
Right. Yeah, thanks. I hope someone from AARP is listening.
Yeah. They may not be happy with my answer just now, so we'll see.
Okay. Yeah. The second question is about the lessons learned for China. He was asking that you have been working with the Chinese schools of public health. What's your thoughts on the benefits of what lessons learned of U.S. nursing homes for China?
Yeah, that could be its own talk, but I think in a nutshell, prioritizing, I think high quality, paying the workforce well, because I really believe, when I visit nursing homes in the Netherlands, for example, they pay their workers better. There's a lot more of them. So I think the takeaway from this talk is really China, much like the U.S., should invest in that workforce. This shouldn't be trying. I think oftentimes in the U.S. we've tried to do this on the cheap, on the backs of families and on the backs of low-wage workers. And once again, I'll say this: you get what you pay for. We really need to put more dollars into this system.
True. Yeah. And the next question, actually, I probably have the same question. What's your thoughts on the impact of new technologies, artificial intelligence, how it's going to help with the existing problems, and to what extent they may, help. I guess I might add the humanoid that Elon Musk is working on.
The robots are coming for all of our jobs, right? But I think the good news is if you work in a nursing home, I have no doubt AI will be helpful in diagnosis and helping workflow, and there's a lot of areas. But I know Japan is experimenting with robot caregivers. I haven't heard a lot of that here in the U.S., but I will say this is such a labor-intensive work, and that connection between the care recipient and the caregiver is so important that, yes, I think at the margins, technology and AI can make us more efficient. I don't think it's a substitute. I still think you're going to need the workers. And this is an area where a lot of other parts of the economy, I can check myself out at the grocery store, we need fewer workers in a lot of places. I don't think we're going to see quite the declines in long-term care and nursing homes.
We do have quite a few questions. Maybe I can pick up one. This question is about the 1/4 of Americans at the age of 25 need nursing home. Why the younger person at age of 25?
No, and I may not have said that well. That's over the rest of their life. So going back among individuals age 25 who lived at age 25 over the rest of their life, so encompassing their older ages. So that goes forward. And then by the time you get to 65, even a larger share. But that's not, there are younger adults who need long-term care, nursing home, but it's not 1/4. So that's just over the rest of their life, the 1/4 of them will need nursing home care.
Yeah. Last question about the payment model. Do the elder citizens pay to the nursing home out of a pocket, or is there any other scheme? The nursing home, I guess he or she was asking, is that a non-profit organization or for-profit?
Yeah, so both great questions, and maybe areas where China could also think about this. We have a mixed system here, so I'll start with the second question. It's predominantly for-profit, so about 2/3 of nursing homes are for-profit, about 1/4 are nonprofit, and the remaining 5 to 10% are government owned and operated facilities. So that gives you, it's a largely for-profit sector. In terms of payment, our system is broken. I hope China is going to go down a better path. We don't have universal long-term care coverage in this country. We have Medicare for healthcare, but for long-term care, you're paying out of pocket if you have the resources to do that. Once you spend down, and nursing homes are very expensive. Another kind of takeaway for China would be to have a more integrated, universal-based system and not try to cover everything in a piecemeal fashion, because you end up having a lot of conflicting incentives.
Great. Thanks, David. I really appreciate your presentation and your response to the questions. So this really helped the audience and myself to understand the long-term care system in the United States. And I think there's a lot of insights that could be used for the Chinese system. Thank you. Well, it's not in person. We probably give you a virtual round of applause. Thank you.
Thank you. I appreciate the invitation once again. Thanks, everyone.
Thanks.